We've entered a new era of healthcare, one of which is that we realize we can't go it alone. And so our partnership with Cerner enables us to actually innovate together, to find solutions together.
The single focus is patients and making sure that our patients have a better experience, have a quicker experience, have a less costly experience, and in the end, they really have better health care.
Interoperability is important to us because we are surrounded by different organizations that have different EMRs. We started working with Cerner on connecting to Commonwealth. We need a set of tools that allows us to get that data from whatever data source it might come from.
We're able to leverage our Cerner relationship through the patient portal technology to allow our patients to simply go to our coxhealth.com website and request an appointment with any provider within Cox, and that's been hugely successful.
Truman Medical Center has recently adopted new technology for our nursing staff, which is the Care mobile device. Putting the latest technology in their hands, but it benefits our patient population in helping to ensure safe patient care with everything that we do.
Healthy Intent can really drill down and tell us who needs our services. But what I do is I look at our utilization in our ER, who are our top users and why are they using. Here we do preventative and primary care so we can take the utilization out of the ER and put it into a better place.
The emphasis to our physicians is that we're trying to make things better, we're trying to make things simpler, we're trying to give them a better tool to help them take care of their patients.
An essential clinical data set is those pieces of data or information that clinicians would want to collect for every patient. Well, we've reduced the duplication of those questions asked. When we bought the nurses back time with the reduction in the amount of sections and questions in the form, we've increased the amount of time that nurse has to then spend with their patients at the bedside, as well as reduced that duplication of asking the patient over and over.
So some of the accomplishments we saw after go live was the financial metrics, one of them being DNFB, or discharge not final billed. That decreased substantially.
When we made the choice to go with Cerner, it was an easy choice to choose their revenue cycle tool, as we knew we wanted the clinical tools that Cerner had to offer. It makes the whole revenue cycle team and the organization a lot more efficient and adds cash to the balance sheet.
Our partnership with Cerner has really been able to put us out in front, and I think is one of the main reasons why we have continued to be successful.
We compete locally for talent. Anytime that we can make work easier and less stressful for our team, we're more likely to keep them engaged and employed.
The future should be about personalizing care and partnering around changing the trajectory of clinical outcomes. Cerner is a critical element for us on that journey.